Weight control attempts by middle-aged New Zealand women are not linked with a change in weight 3 years later. That's the finding from new University of Otago research. And to explain what it means, we're joined by researcher and study co-author Sook Ling Leong. Good evening.
Good evening.
This is a disappointing core finding for your research. Tell us a bit more about it.
So what you have said, the results of our study showed that weight control methods, both healthy and unhealthy, are not related to weight change 3 years later. The results also showed that those who were trying to lose weight were more likely to engage in healthier eating habits compared to those who were not trying to lose weight. However, they did not differ in the frequency consumption of their high energy dense food. Lastly, the results of our study also showed that people who were attempting to lose weight at the beginning of the study had a reduction in the degree of eating in response to hunger and fullness signals.
What do you think this finding is going to mean for the dieting industry?
Well, there are a lot of people out there who are successful at losing weight with dieting. This is not the first, although this is not the first study showing that weight control is related to a short-term success in weight management. What the results of our study suggest is that it may be worth considering a different approach to weight management rather than forbidding yourself to eat certain foods, maybe eat in response to hunger and fullness signals.
How was your study conducted?
The study was a longitudinal study. It was a prospective study, a prospective survey of around 1,600 New Zealand women between the ages of 40 and 50. So at baseline, we collected data on their weight control methods, and then they completed the survey again 3 years later.
How groundbreaking is this for nutritionists?
Well, this may be the first prospective study in New Zealand showing these results. However, it's consistent with research overseas. So, for example, there is a US study among teenagers showing that dieting is related to binge eating 5 years later. There is an Australian longitudinal study on women's health showing that women who use one weight control method gain less weight compared to those who use 2 or 3 weight control methods.
What style of eating would you recommend?
Well, we did not survey that in our study, so I'm not really able to comment on that. I'm just wanting to stress that intuitive eating may be something worth considering as approach to weight management.
Could your research help to end the body shaming of larger people, do you think?
The intuitive eating approach encourages people to be more accepting of themselves. So paradoxically, when we accept ourselves, we are more likely to engage in health-promoting behaviors, such as eating more healthy foods and increasing physical activity. Weight stigma, on the other hand, is linked to unhealthy behaviors. So in short, I would say that feelings of stigmatization can be very disempowering.
Do you think we'd be happier if we just ate what we wanted when we wanted?
Well, I wouldn't say that exactly we would be happier and healthier, but if we eat intuitively, we may be happier and healthier, one, because we would stop eating when we are physically full, and second, it would allow us to avoid the guilt that is related to eating foods that we have labeled as forbidden.
Now, this study is over, or will it continue on?
Well, this study was part of my PhD research in the nutrition department. So I'm not in the working in the nutrition department now, but the principal investigator of the study, Associate Professor Caroline Horwath, and her team at the nutrition department are looking at intuitive eating and weight change 5 years later. So they are also looking at a study where they have an online web course teaching intuitive eating to women.
University of Otago researcher and study co-author Sook Ling Leong, thanks so much for your time.
Thank you.